Hi, happy Wednesday, Colette. How you doing?
Wednesday, Adriana. I'm doing just fine this evening. How are you doing?
I'm doing okay. I'm exhausted, but a good exhausted. I like being exhausted from work. I don't mind being exhausted.
I don't blame you. I miss going to work, so I'm a little jealous. I'm not going to lie. But I did start my summer sessions this week from home. Well, last week. Yes.
You're still doing virtual?
Still doing virtual classes.
Okay.
But it's going well. I have to say, the mommies are still into it. They still want to come every week, but it's, like I said, it's never the same than seeing the babies in person. So.
Right. It is. It's great seeing them in person. But like I said, it's exhausting. So thankfully we have wine.
What are you drinking tonight? That looks like water. What is that?
No, it's a big glass of good Pinot Grigio.
Oh, it's very light. It's very light.
It is very light. You know what they say? The lighter the color, the better the quality of the wine is. So when you're looking for a bottle of Pinot, if it's yellow, don't buy it. It's more of like a clear color. It's a better quality.
Delicious. What kind is that?
It's yellowtail. I always get yellowtail.
Really?
It's nothing fancy. No, it's nothing fancy. It's yellowtail.
Interesting. So
what about you?
I have, mine looks yellow, but mine isn't a Pinot Grigio. It's actually
a Chardonnay?
No. So it is a blend. I know you remember we had the One Hope.
Yes.
So I had ordered the Pinot Grigio, which was delicious. And then I had ordered a sparkling peach, which I haven't tried yet. I think you got that one too. We should probably try that.
No, I got the sparkling Moscato, which was unbelievable.
Oh, you drank yours already?
I drank it. Sorry. It doesn't last long in my house, Colette. It doesn't last long.
So, well, as you know, I've been on a health kick, so I really haven't really been drinking much. But yesterday I opened this bottle and it's called Symphony and it's a blend. So it's almost like, I want to say if a Riesling and a Pinot Grigio had a baby.
Oh, nice.
So it's sweet, but it's not too sweet because I don't really like sweet wines.
Okay.
But it goes down very easily. So I will definitely be ordering more of that. But cheers to you.
Cheers to you. And please let me know.
I will. I'll let you know.
Let me know when you order again so we could do another order because the Moscato that I had from them and the Pinot was excellent.
Okay.
I wanted to try the peach. I didn't try the peach, but I wanted to try it. So I'll probably put that in my next order.
Perfect.
Yes. Good. So you have been to the hair salon lately?
Oh,
no, I have.
Did you notice?
I didn't notice your hair is done. What did you do?
Actually, so I got a Brazilian blowout, which I usually do. I started doing this like 2 years ago. Because my hair, not that I had like, you know how some people have really big hair. It wasn't like that. It was just like the ends would get all, and then like I would always have this like constant wave in my hair.
Yeah.
So I got it done. And in the beginning, it only lasted like 3 months or whatever. So I had to keep going. But I'll tell you, I haven't had one done since I think last August.
Oh, wow.
So it started, I definitely needed it done in like May, but I was just putting it off.
Right.
And I got it done. And I have to say, in the beginning, I feel like my hair is just like plastered onto me. So like that's what did you get one done also?
I got one done this morning. Yes.
Oh, there you go.
Yeah, because my hair gets huge. Like I have thick, curly Sicilian hair. So any humidity, it just goes poof. So, and I usually do it. I'll even do it in the wintertime, believe it or not. Like I'll do just my crown in the wintertime just to keep like the baby hairs flat and then do the whole head in the summer. So I just did that today, luckily at Main Bar, and she did it for me this morning and I cannot wait. I have to wash it on Friday though.
Yes, I know. That's what I did. So I went last Tuesday and then I went on Friday.
Yeah.
But you still have to be so careful because I could already see, like last night I put my hair in a ponytail yesterday, but I didn't wash my hair this morning and I definitely have a dent right here.
Yeah, definitely.
That's okay. It just feels so much better. It feels like light, airy. I actually went to the nail salon for the first time. That was exciting. Although my nail polish already chipped, but that's okay. I needed a manicure. I got my feet done. I felt terrible for the pedicure girl. I was just
oh my God, I know.
I'm like, you need a chisel? What's going on?
I know. No, it's bad. It's bad. I had Lucy Nail Van come, the lady that comes in the van in my driveway. Listen. I love her. She's amazing. She did my gel manicure and my gel pedicure. And I'm going again on Monday. She's coming. She's parking in my driveway and doing.
Don't come out so I didn't like bang on the door.
No. My husband gets home. So I tell him, I'm like, no one's allowed outside. No one could go in the driveway. It's like pretend mommy went to the nail salon and that's it. And I have my time, in the van. like no, like my whole life in a minivan, because
because we don't ever leave the car.
No, because we live in vans. So, but I do have something for you that I saw on Facebook. Her name is Debbie Susie, and she makes these cutest things. Look at this. It says, "I don't give a sip."
Oh.
And it's an adult juice box, and it comes with a straw. You fill it with any alcohol, and you could drink out of it. You could wash it. It's reusable. It's great by the pool. So I have to stop by and give it to you, and then we could take pictures of them in use.
I love it.
Amazing. I ordered you one because I said Colette has to have one.
You're such a good friend.
I know. Every time I think of wine and drinking, I think of you. So it's great.
I don't know if that's a good thing, but okay.
How is your Weight Watchers going? Everything all right on schedule?
Yeah. Well, I now combined it with intermittent fasting.
Yes, you said you were going to do that.
I have to say, this is actually working great. I mean, I have to say, it's not like I'm losing 1 million pounds, but in 2 weeks, not even 2 weeks, I lost 5 pounds already. So I was excited about it. Listen, I'm getting up there. Everyone tells me once you hit 40, it doesn't.
That's it.
Yes.
When is your 40th birthday, Colette? If you don't mind me asking.
August 28th.
This August?
Yes, next month.
OMG.
Oh, thanks.
We're going to have to celebrate. We're going to have to do something.
We are going to have to do something.
All right. We're going to have to plan like a Wine Down Wednesday 40th bash for Colette.
Oh, I would love that.
We have to.
Fun. Will there be strippers? No, I'm just kidding.
No. It's not your 20th birthday, Colette.
Well, that's why I need it even more, Adriana.
I know. Please. Crazy. I always thought you were the same age as me. I didn't know that you were a little bit older.
Yes, I am. But
just a little bit. It's okay. You don't look it.
Thank
you. You don't look it. You don't.
Age is just a number.
It is just a number.
As we say. But, as we get older, things change.
Oh yeah. Oh,
we get
change.
Wrinkles in places that we don't know.
Yeah, like right here.
Things start sagging.
Yes. Yes. So that's what brings us on to this week. Yes. This week, I mean, I know it was a huge sensation when you mentioned you wanted to get boobs as your luxury 40th birthday present, while everybody else was saying bags and clothes, and you just came out and said it, and it was such a hot topic because so many people don't talk about it, like they're ashamed to talk about it.
Yes.
And so that's why I thought it was a good idea to have who we have on today, because a lot of people tell me, you had twins, your stomach is so flat. What did you do? And I just tell them I had a tummy tuck. I'm not going to lie, because there's no going, like once you have twins, and you have twins the size that I had, like they were 6 pounds each. We went into 38 weeks. Like we did the long stretch. It was no going early. So my stomach was the size of my dining room table, so there was unfortunately, there was no going back.
Yes.
And then plus I had health problems, which I'm going to talk to, the doctor and everybody that's on today about it, and like how we can recover from it, and how it's okay to talk about plastic surgery at this day and age.
Yes, I agree 100%. I think a lot of people think it's taboo, or a lot of people think that it's vain, like a vanity, yes, things like that. So I think it's a good topic to discuss, and I think that everybody has their own opinions on things, which is fine. But I think for a lot of people, it's a way for people to express themselves. I think it's a way for people to, and people, I think a lot of times think of plastic surgery and they think of like a cosmetic, like, ooh, that's, like I said, very vanity. But a lot of people do plastic surgery for reasons, like they've had, mastectomies, or, you had, you got into an accident and you needed to get plastic surgery done. So I think there's, varying sides of it. So I would love to learn about it and hear about it. So I'm really excited about our guests we have on today.
Yes. So our first guest is Christina, and she's waiting patiently backstage. Christina is from, hey, Christina.
Hi, guys.
How are you doing? Her face, as you can see, is perfect. She is from Posh Aesthetics and Wellness, and she specializes in Botox and injections. She also does IV, which is something I really want to get into. So, Christina, would you like to introduce your company to us and tell us a little bit what you do?
Yes, thank you so much for having me, Adriana and Colette.
Oh, no problem.
I was trying not to laugh when you guys were talking, but
good luck with that.
Thank you so much for having me. So yes, I am a nurse practitioner. I'm board certified in New York and New Jersey. I own my own business in Staten Island, New York. It is called Posh Aesthetics and Wellness. I specialize in Botox, fillers, chemical peels, microneedling, vampire facials, IV infusions, vitamin drips, weight loss injections. So a variety of things. I have definitely done a large variety of training, so I'm very capable of handling a lot of different situations. And also I can create a lot of different looks. I kind of think of myself as a artist.
Yes, definitely an artist, because I've seen your work, and I've seen, because you used to have a space right by my store. So, and we met through, my cousin actually works with Christina on her, because you are a nurse practitioner by day, or
so I used to work with your cousin actually when I used to work in urgent care. So
yes.
I used to practice family medicine, and then I transitioned into aesthetic medicine because that's truly my passion.
So you're doing just aesthetic now. Okay, awesome. So we met through my cousin Kathy, and I had a meeting with Christina, and she told me everything that was wrong with my face. Like I did when I went to a plastic surgery. It was a consultation. And then we were going to do it. And then I don't know what happened, like, because with my business and everything, and then COVID happened, and then that was that. But I've seen her work, and it's amazing. Like, you could take somebody's face and just look like a 20-year-old, and it's unbelievable.
Thank you. So I'm a very big proponent of aesthetics and enhancing yourself. When I was younger, I had a little bit of low self-esteem. So then I started to get into Botox and learning, what are the benefits and how prevention is key, right?
Yeah.
The biggest thing about all these celebrities that you see out there that look so fabulous, they've started when they were younger, right? And I don't mean to say that a 15-year-old needs to get Botox and fillers. Absolutely not. What I mean to say is you need to start taking care of yourself and doing preventive measures younger, like SPF every single day, hydration, wellness, vitamins. It's all a part of a lifestyle. And that is the biggest thing that I highlight to people every day.
Right. And that's what I like about you. You're not just about the Botox. Like, if you follow Christina, you'll see that she'll tell you what creams to use, hyaluronic acid, and like what vitamins to take. She's not just like, she'll inject you and she's done.
Yeah.
She gives you like a whole, that's also with the IV. IV, go ahead. You could explain the IV, because I can't.
Of course. So I've actually worked with a pharmacist very closely, and I've developed my own custom IV infusions. So I do have a variety of infusions. I have a jet lag infusion, a hangover infusion, skinny mini infusion. I've named them fun stuff. Like, I have one that's a Myers cocktail, which is a vitamin B complex, magnesium, calcium blend, and that's called the Statin Wellness. So a very large variety of infusions. And one of the biggest ones right now is the immunity drip, which is called Body Boost.
Ooh.
So that is a high dose vitamin C, B complex, and zinc. And so all of these components, what they do is they work simultaneously in your body to prevent oxidative stress. Oxidative stress puts your body in a circumstance where you really can't fight off viruses and infections very easily. And so that's when you get ill easily. So it doesn't cure any illnesses, right? There are people out there saying that certain things cure COVID. I'm absolutely not saying that.
Right.
Not at all. But vitamin infusions do help you. When COVID first started, I was working.
I was just going to say, you worked on the front lines. Yeah.
Yep. And I was doing my own IV vitamin infusions at home, literally every other day, because obviously
you were on IV. Yeah. Well, when you're exposed to that, you have to be careful. Right.
And I felt great. Great. I took care of myself. I eat well, and I try and hydrate my body and take all the vitamins and nutrients that I can get. And it helped me tremendously. And as you can see, like, here we are. I'm 30, And I've been really taking care of myself, I would say, since I was like 22. Prior to that, I wasn't really very educated on how to take care of myself. And it does take a long time to learn these things, right? And what I mean is taking care of yourself in every sense of the way, mentally, physically, and emotionally. There is a huge mental component associated with aesthetics, because there is that fine line where people want to augment how they look and not look like themselves. And I don't like that. I really like to just enhance people's features and make them feel good about themselves. A lot of my clients, there's a huge backstory to how they even got to my chair, and what I'm going to do for them, and how I'm going to make them feel better, and what are we going to do to help them become better and feel better for themselves.
Right. And now the weight loss infusion, that's the same thing. It's intravenous, correct?
Yes. Okay. So it goes into.
I know.
Tell me about that one.
So that one has methionine, inositol, and choline. Okay, and then we do add a B complex to it, and L-carnitine. And some of these are customized. I can do add-ons to some of them. And basically, all of these vitamins, amino acids, and minerals help boost fat metabolism, okay? And by improving fat metabolism, and you detoxify the liver as well. So you're burning fat very quickly. And these are not anything harmful. They don't affect your body in a negative way. They don't increase your heartbeat.
That's what I was going to ask you.
I'm really against things like that. Like I'm not even I don't even promote like phentermine. I just feel like I've seen young people, especially in family medicine, that develop cardiac abnormalities.
Yeah, from that, right.
So, yeah, I don't really support things like that. I'm more of like the natural approach. And listen, I'm not saying that that's wrong, right? If you need to do something for yourself to boost things, then yes, definitely do it. But make sure it's under the correct medical guidance. It's just, I'm just not very much in support of it from my clients in my practice.
And now with the intravenous, with the weight loss, how long, like you do one per month or once a week? Like, how does that work?
So you can do it bi-weekly.
Oh, you can do it every 2 weeks.
You can do it bi-weekly, and you definitely have to eat healthy and exercise at the same time. But it truly does work. When I work nonstop. And so, I work 7 days a week. Your cousin will tell you.
She's pretty crazy. She's pretty out there with the work. She does. She was like on the front lines in COVID.
I feel like I need to do it all.
To be out there, right?
Yeah. And so I really rely on my weight loss infusions to help give me that boost. I try to wake up early, do like a 20-minute workout on my Peloton, and then head out the door, right? But the infusions give me that extra boost.
Okay. How long does it take? Like when you do the infusions, is it like a half hour, 40 minutes?
Yeah, like 40 minutes. That's not bad. And I always monitor vital signs before, and I always have an AED on hand. I'm very safe.
Okay. Oh, awesome.
And what do you find your like? I don't want to say target audience. I'm sure you have a wide span, but do you find that you have mostly like 30 to 40-year-olds coming to you, or do you feel like
I would actually say more 40 to 55?
40 to 55.
Oh, really? Wow. Okay.
Yeah, which is really interesting because when I initially started the IV infusions, I thought I would have more of a younger crowd that was more so interested in maybe the jet lag or the hangover.
Right.
But not necessarily. The 40 to 50-year-olds, and I would say primarily females, are very much attracted to the infusions because they know that they work and they've taken the time out to actually research them online.
What about the Botox? Like, what is your age range in the Botox? I'm sure that you could start that at like 20 years old, right?
Yeah, I would say my age range is between 28 to 35.
Oh, okay.
Botox. Yeah. So Botox, I feel like people either love it or they fear it. And the reason being is because they see a lot of people that are like super surprised and they're like, I don't want to look like that. So if you see my forehead moves, my face moves, and I have 100 units of Botox in my face.
You know, her face is
Christina,
your face is pretty awesome. I was like, I want that. Like, I want that look.
Thank you. There's so many different things you can do with Botox. So Botox is a toxin and it temporarily paralyzes the muscle. So it lasts anywhere between 2 to 4 months based on your body, to be quite honest, based on your metabolism, your body, how it goes through your body. And it's temporary. Okay. And you can use it. The majority of the areas that people use it is the 11 lines, the forehead, and the crow's feet.
Do you see me? I'm like,
Mine too, as I laugh and it all moves. Yeah.
Oh, yeah. And you know what? People wait till it's kind of too late to start. Once you start getting that
right, like, because I know, like, because my sister's been doing it for a while. My sister, I think, started when she was 30, and she started doing her crow's feet. And I'm like, well, why are you doing it? You're so young. And she's like, no, you have to do it before it gets too bad.
By too late.
Let me see, Colette.
But you have to come have coffee with us, Colette.
Yeah. My fake eyelashes are covering my crow's feet. I put them on like over here.
Still like windshield wipers right here.
Cover the wrinkles, right?
Listen, I gotta do what I can. Gotta do what I can.
You know how I explain it to people? I try to explain to people that, like, if you have a wrinkle in your shirt, you can iron it. But if you're sleeping on the mattress in the same spot and you have that indent, you can't get that out.
Right.
Yeah.
And like, and see, Christina's good where, like, when I went to go see her, she suggested a few amounts of injections, whatever. And then I was like, wait a minute, I'm a little afraid. Can we tone it down? And she wasn't like, no, that's it, go somewhere else. She was like, no, let's do what you're comfortable. We'll work with you. That's what I liked about you. I didn't like that you were strict about your price and strict about how many injections I needed. And you were willing to work with me, which I know a lot of places are not. They would be like, all right, goodbye, to somebody else.
Because you know what? I want you to come back. I want you to be happy.
Right. You want us to be comfortable.
The biggest thing. I want you to be comfortable. You know, this is not new for me, but it's new for you. And it's our first new experience together. So I want you to be 100% comfortable. And it's frightening for some people, right?
It is. I'm a little afraid.
Injecting something in your face.
Right. Like, I don't want to be stuck frozen. That's what I'm afraid of.
Yeah. Because there are
really
people that like that look, right? Some people like that look. And that's the extreme, right? So it's very interesting, right? Because we're all from Staten Island. So Staten Island, there's a crowd of people that like to do procedures and never talk about it.
Right.
For some reason. And then there's a crowd of people that overdo it, right? Overdo it. Go to 5 different people on the island and shop around and want a tune-up here and there. And so that's what scares people. But you know what's really interesting to me is I feel like a lot of people that are afraid or don't talk about it, it's primarily because they feel like they're going to be judged by other females. Like males don't do that to each other. No. They don't judge each other. Females judge each other. It's like with like breastfeeding, right? Like
who does it, who doesn't do it, right?
Like, how long did you do it for? What'd you do? And everybody wants to give you their opinion. It's unnatural. You have to do this. You have to do. It's like, who cares? Just do whatever makes you happy.
Right. Exactly.
Yeah.
And that's the same thing with the lip injections. Like, you see people that it looks great and it looks natural, and then you see when it's overdone. And you're like, oh wow, like she really shouldn't have done it.
You know, I actually just got my lips dissolved by one of my friends who's also an injector. She goes by Botox Nurse on Instagram. But so over time you build filler, right?
Okay.
And then what happens is sometimes over the years, I've had built up filler for like 4 years. So you build it over time.
Okay.
So, but then it can migrate, it can move. So I overlined my lips today, but I've dissolved it. So she dissolved it. She helped me.
Yeah, it looks natural.
Nice.
Yeah, it's good.
And then I'll refill them because I like them a little bit.
Right, and you can. Like if I did my own Botox, I'd be like this.
Yeah. It's a battle. It's in the fridge every day. It's like
I would be
creamer and Botox.
Right.
What am I gonna choose?
Right. I know Colette would be going crazy.
Oh my gosh,
what's funny? I was never one to even think about this stuff until now. And now I don't know if it's too late because you told me it might be too late. But like,
it's never late.
But I've never thought of these things, honestly. Like I just, when your age also just creeps up on you, like and that's what's happening now. And now I'm looking and I'm like, oh, I mean, listen, I think everybody's beautiful if you choose to do it or you don't choose to do it. Everybody has their own feelings about things. And, some people just want to age naturally and not, my mother never had anything done to her face.
No, my mother neither.
But my mother but I got to tell you, once she hit 60, she talked about it every single day. And now she's 73 and she still hasn't gotten anything done.
Right.
So
it's different. Like, we have so many toxins in the environment now. Yeah. We have so much stress. Stress is a huge factor in all this.
Stress is a huge factor. It's nothing like what they had. No, definitely not. And I feel like it was more taboo back then than it is now.
Of course.
Yeah. Like if my mother or your mother got it back then in the 80s, it'd be like, oh my God, they did Botox, so they had plastic surgery, where now it's a little bit more acceptable, but it's still kept secret. Like a lot of people won't talk about it,
Of course, it's interesting. I have actually clients that are friends, and sometimes when they bump into each other walking in and out,
oh, what are you doing here?
They're like, oh, what are you doing here?
Nothing.
And then they're like, oh, what did she do? I'm like, I can't tell you that.
I can't tell you.
HIPAA. That's against HIPAA. If she chooses to tell you, she can tell you.
Right.
But absolutely not. But it's so interesting. Like even friends still keep it a secret from each other.
Oh, see, my cousin Kathy's commenting now. She said, Christina is beautiful inside and out.
Oh,
and so is Kathy.
Kathy
Kathy is beautiful inside and out. I know.
She's so
I know. Sweet. You guys worked together for how long and urgent care?
Almost, I think like 2 years.
Yeah. And then you worked on the front lines in COVID. You did the testing, right? You worked at the testing places?
Mm-hmm. So then I worked in New Jersey at a testing site, and I worked at multiple locations, and it was like a crazy time.
Right? Crazy. I heard from a lot of nurses.
Yeah, people went from being so scared and terrified to not caring, and it was just havoc.
And what are you doing differently now because of COVID? Like I know we have to do the mask wearing, but what other precautions do you have to take? Okay,
so what I do is I have set forth a few guidelines. So when so I rent space inside of Liquid Sunshine, which is a suite. And primarily specializes in airbrush tanning and body sculpting. And so, the
body sculpting is something too, Colette. I know.
That's amazing.
They have a lot of money.
You have to watch it. They literally beat you with wooden boards.
I don't spend my money on anything except right here.
This. I know.
I don't buy purses.
Me neither.
I don't buy anything. Nothing. No, this is it.
Are they still doing the body sculpting? Is that allowed now?
So I think that they have certain restrictions. Yeah. So what it is that I come and go, so I don't really bump into other people often. But so I have my clients come in and they park downstairs and they text me before, right? They text my work number and then I'll let them know if they can come in because I need time between clients to sanitize everything and disinfect and change the sheet on the bed. Right? I really want to take accountability for everything.
Of course, because you have to be careful.
And at the same time, I really need a minute to catch my breath. It's hard to breathe when
you're... we get it. Yeah, we get it. When you're in a mask all day, it's insane. Yeah.
And then I email people consent forms and they email them back to me. I've actually had to make 3 separate COVID consent forms, one regarding symptoms, another questionnaire, and then an informed consent that, you're willingly putting yourself in this position to receive treatment. And and it's interesting because even certain aspects of the face, let's say I'm injecting the lips, right? I don't rush anything, right? And at the same time, I also, we take the mask off and then we put it on once it's done, a new mask.
So, because you're taking it off to do the injection and then putting it on again. Okay.
And you don't want to have any infection. That's the biggest thing.
No.
Right. So I always really stress a clean mask on your face because if we just injected your face, you have micro tears in your face and we will make sure that there's no bacteria going in.
Right.
You really have to take care of it.
And what is the recovery like for Botox? Let's say, do you have to stay away from the sun? Are you at home? Like, what is your recovery time?
So Botox doesn't kick in until about like 10 to 14 days. 14 days is when you see the full effect of Botox. Filler, you see the full effect immediately, and then the swelling goes down after 2 weeks.
Okay.
But what I typically tell people for Botox is you cannot lay flat for 4 hours. You can't look down at yourself for 4 hours. Yeah, you don't want to droop.
Anything.
Yeah, I tell people to avoid the sun for several days also, because if the sun beams on your forehead, it can cause like a sunburn and swelling and diffusion. And also you can't wear a hat for 2 weeks because then we'll have
you don't want to, wrinkles from the hat.
Yeah.
Oh,
and
okay, so it's
nothing 24 hours.
Right. So it's nothing too crazy.
No, nothing drastic. And you know what? I know that this sounds kind of crazy because a lot of people don't have anywhere to go, but this is the time to do
it. Yeah, I know. Because you're home.
Downtime.
Yeah.
You have home. And then you can also see how you look with the procedure, right? Some people like the way they look with a certain procedure. Some people don't.
Yeah.
Right. Oh, well, that's good to know.
Yeah.
And Christina, what are you drinking tonight? We forgot to ask you. We went straight into the Botox.
I would never pass this up.
Oh. Now, I know you're a big Fit Vine person because I see you posting the diet wine. Is that what you're having?
I'm actually having White Claw, and the only reason why I'm having White Claw is because I ran out of High Noon, and it's really not my fault.
We're big High Noon fans. Yes.
Yeah, it's my boyfriend's fault. He's in charge of doing the food shopping. So.
Yeah, I know, but you can only get it in liquor stores. That's the only thing with the High Noon. Like you have to go to the liquor store to get it. But it is excellent. We all love High Noons and White Claws too.
Yes, I've been trying to cut back.
No, I know. Please. And now you don't have children yet.
No kids. Hopefully soon. Well, not too soon. That'll be a struggle with the Botox.
Oh yeah. Oh, definitely. Because you can't do it, right? Because my sister was like, she did it, and then when she was pregnant with my niece, she had to stop, and then she redid it, and then when she got pregnant with her second, so she's like, my whole face is gonna droop, and I'm like, no.
Like, so that's another thing, Adriana.
Yes, I was just gonna tell you. Think that it's gonna go back down.
That goes back, or people say that once you get Botox and then it wears off, your wrinkles are worse.
Right.
Like, absolutely not. Like
it's not. Okay.
That's not the case. That doesn't happen. But yeah, for when that happens, when I am pregnant, 9 months of actually seeing my facial expressions more than now is going to be a problem.
Yeah, right.
I'll have to keep wearing my mask.
Yeah, because you can't do anything. You can't do injections. You can't do nothing, right?
Nothing.
Even the venous. Yeah.
Even retinol.
Yes, you're right. The retinol you can't. You're right. Yeah.
But it's worth it. It's worth it.
It is worth it. It is. It's got to be worth it. I still have to do it. I have to make the appointment. I have to get away from my fears and just get it done. Colette, come with me. Maybe we'll tape it.
Okay. Maybe. Well, I will come with you and support you. I will see what happens.
And then you'll do it. Oh, thanks. I'll be like the test dummy. The Botox.
I had a client come in the other day, and she dragged her sister with her, and her sister was deathly terrified to do it. And she texted me just yesterday a picture, side by side, her with her son before Botox and then after the Botox kicked in, and she's like in love with it. Meanwhile, when we were injecting her, she was like,
no, I'm a little afraid of needles, but I could do the pain. Like the pain doesn't bother me. After going through a tummy tuck, I think you could go through anything.
Oh, I can't wait to hear about that.
Nothing. Yes, no, I'll definitely get into it with Dr. Asaad after, we talk to Christina. But I'm still a little afraid because it is your face, but I have to face the fears and just do it. And I know, Christina, you're doing a giveaway right now, currently on your Instagram, right?
What is
so? I'm doing a giveaway.
Yes.
So the lip flip is Botox injected into the orbicular muscle right around the lip, and it's the perioral muscle. And what it does is it relaxes the muscle here, so that way you kind of just lift a little bit up. I look a little distorted.
No.
Yeah, the orbicularis oris muscle right here. So you inject a few units of Botox. And
it lifts it up.
You get a lip flip, and it's temporary. It's between 2 to 4 months, and it just gives you a little bit of like a little perk.
Okay.
I like
And
that.
the reason why I'm doing this is because I feel like it's been a rough year for everyone. And I'm doing a giveaway for a lip flip once a month, every month till the end of the year.
Oh, interesting. Let's do it, Colette. I'm going to thank you every single time.
Yeah.
Because,
I feel like it'll be nice to give
have been
people
through hell. We've been through hell, and we're probably going to continue to go through hell because now they don't even know what's going on with school.
Yes.
That's crazy.
It's insane. It really is. But we don't have to get into that. I want to introduce our first male guest ever. And Christina, he is a friend of yours. So I would like you to give him the honors and talk about Dr. Asaad to everyone and have him on.
Sure. So Dr. Asaad Samra is a board certified plastic surgeon, and he does own his business in Homedale, New Jersey, and he's absolutely amazing. Dr. Asaad.
Hi, Dr. Asaad. Welcome.
Hi, guys. Thank you very much.
I know I told you it wasn't necessary for you to have a glass of wine or anything, but do you?
I brought myself a little vodka
you
tonic.
did? Oh, nice.
Nice.
Because I wasn't sure if he was still working or he wasn't working.
No,
if he was
no.
allowed to.
Work is done for the day.
Oh, excellent, excellent. So now your office is in Homedale, New Jersey.
Right. So I actually have an office in Homedale and another office in Old Bridge, New Jersey as well. So those are the two main offices that we have.
Oh, you're close. So close.
Yeah, no, he's not far from Staten Island at all. And do you specialize? Do you have a certain area that you specialize in, or it's just full plastic surgery?
I do the full gamut of plastic surgery, which is head to toe and skin and cosmetic and reconstructive, trauma, pediatric, all of that stuff. But I do focus on breast reconstruction. So reconstructing the breast after a mastectomy, for example, as well as doing cosmetic surgery of the face and body.
Oh, so that's good to know. Like for the pediatric, like God forbid something happens, do we have to go to your office, or would you be able to come? Because I know a lot of my friends that their child has fallen and they have a big gash and they're in the ER. Can we call you to come to the ER, or do you suggest the child come to your office?
So honestly, sometimes it depends on the circumstances and how significant the injury is. A lot of times it's a little easier and more comfortable to do it in the office. If, however, you're already in a hospital setting, and I have privileges at that hospital because I can't go everywhere.
I know
then I'm more than happy to come there and take care of it.
Okay, because I'm that mom that would be like, no, I don't want that giant scar on this poor kid's face. I would be that mom, you know.
Absolutely.
But that's also another thing like I wanted to talk about. I know a lot of moms won't talk about like breast, we'll say boob jobs or tummy tuck, and because it's such a taboo thing to talk about. But I had twins, so like every time I would see somebody, they'd be like, "Oh, how's your stomach so little?" And I won't lie, I won't be like, "Oh yeah, I worked out and I did yoga." I'll say I had a tummy tuck because.
And why?
And because when you have twins, like my twins were 38 weeks, they were 6 pounds each, so that's 12-pound babies plus the placenta, so there was like 25 pounds of stuff in there, and I was a small framed person, so I went from having a little stomach to being the size of my dining room table. And naturally, I thought, like with my first child, I thought everything was going to go back down and it would be fine. But it didn't with the twins. Because they literally ripped me in half. And I would go to the doctor and I said, why do I still look pregnant after a year? And I went to my family practitioner and she said, I guarantee you have cystic recti, where your abs are split.
Right. And
I winds up having a 3-inch gap in between. Like you could literally put both hands in my stomach. It was the grossest thing ever. And she's like, you know what? And I had 2 hernias. I had 2 intestinal hernias as well. Wow. So everything was popping out. And she's like, you're not going to be able to work out. This won't get fixed by itself. So I waited a full year because I heard that the recovery for a tummy tuck with 2 babies was going to be tough, because how am I going to take care of my 1-year-old twins and my 3-year-old son? So I waited a full year. And then I finally got it done. I remember school was over June 26th for Antonio. I went to have my surgery July 1st.
Wow.
I was like, yeah. And I went to Long Island. I went to the Dr. Alan Friedman in Great Neck, Long Island.
Okay.
and I winds up getting it done. And then a lot of people go home after the surgery.
Right.
I didn't. I paid extra and I stayed in his office on a morphine drip. And it was the best vacation I've ever had since then.
Maybe now I need a tummy tuck. Tell me all about it.
It's the best night ever. I mean, it's painful, and I'm sure Dr. Asaad will say it is a big surgery. I was in surgery. I was in about 7 hours but I did lipo as well. So I had a lot going on.
Gotcha.
Going on.
Yeah, no, you're absolutely right. That having babies in general can wreak havoc on your body, but having twins can be much more dramatic. Just because, like you said, all of that pressure from the inside pushing out, separating the muscles and stretching the skin. And a lot of times women will develop stretch marks on their abdomen.
Yeah.
Yes.
Basically is a sign that the skin stretched beyond its ability to recoil. So when you have stretch marks, unfortunately, what that means, even if you lose a lot of weight, the skin will become looser and looser. And to the point of your physician from before, there's really no amount of working out or exercising you can do.
She told me, she said, that's exactly what she said. She said, you'll lose the weight, but the stomach and the skin will still be there. And having a C-section doesn't help it either, because once you have a C-section, I don't know, Colette, did you have a C-section? No. So once you have a C-section, they're already cutting into the muscle. Right. So you're cutting into the muscle and the skin. You have like that apron, and I just couldn't. And no matter how nice my husband was, and I was like, "Oh, it's not a big deal," I couldn't stand it. I'm like, "No, I don't care what it is. I'll finance it for my whole life. I have to do it.
Gotta go."
You know, but in my situation, my insurance covered some of it because of all the medical reasons and the hernias and everything else. And we were able to get some coverage out of it, but it was. I mean, as much as the recovery was hard, I'll do it again tomorrow to feel the way I feel now. Because it gives you that boost of, that your self-esteem. You need to feel good, Absolutely. Because if you feel bad about yourself, you'll never feel good, unless you have it fixed.
Yeah, and I think you really just touched upon one of the biggest almost misunderstandings really of cosmetic surgery, that's what it does, is it gives you confidence back. It's not about trying to look like somebody else or be different. It's just to give you that confidence and that kind of belief that you're enough. And that's really, I think, what's important about cosmetic surgery, that again is sometimes overlooked just as vanity, and it's really not about that.
Right. And I know Colette said she wanted to get a breast augmentation for her 40th birthday.
Well, yes. Well, this has been since I'm 16 years old. I've always wanted this done. I'm not kidding you. You have to understand something. So I am, I'm very close with my family, with my parents. And I have to tell you, the biggest reason I never got it done is because they were so against it. And still to this day, if I decided to do it, I'd be nervous to tell them, because I'm 40 years old. Could you imagine? But it's the truth. And I feel like a lot of people get pushback from family members and things like that. But at a certain time, you have to, take responsibility, and just
like my mom was more okay with it, but my grandmother, God rest her soul, she thought I had a hernia surgery. She never knew that I
can't really cover this up. I can't be like, what do you mean, Mom? We should do it. Nothing happens.
Right. Like if for them, it was like, no, you can't do this. What are people going to say? Like you had to tell them, like, well, you only think about yourself. Like for them, it's so old fashioned. But like I see exactly what you're saying, Colette.
That's the problem, is that everyone's always thinking, oh, what is everyone else going to say?
Right.
Who cares? Like, it's about your happiness. Colette, you should do it. I got a breast augmentation 2 years ago, and I love it.
Oh,
I actually regret not doing it. The doctor suggest. Well, when you go in there, and Dr. Asaad will tell you, they pull out this horrible marker, and and he starts saying, okay, well, like, and you're standing there basically naked, just underwear on, and he's like, all right, well, you're gonna have to do this, and they draw on you, and you're like, holy shit, do I really need all this?
Is it really that bad?
I'm like, oh, okay, I guess. And then so he suggested doing the whole mommy, like it's called like the mommy makeover, where you do like the breast lift. I regret not doing it. I do regret not doing it.
What is the mommy makeover?
The mommy makeover is not so much an implant, right, Dr. Asaad? Or you can let him explain it.
Yeah, I mean, the mommy makeover is actually just a very clever marketing term for any kind of surgery done on a mom.
Right.
Right. That's basically what a mommy makeover is.
Right.
Now, to be a little bit more specific, I'll tell you that typically a mommy makeover is describing having some sort of a procedure done on the abdomen, like a tummy tuck,
Okay.
and some sort of a procedure done on the breast, whether it be a breast augmentation or a breast lift, or combining them, doing a lift and an augmentation. So the classic mommy makeover would be a tummy tuck with something to the breast.
Oh,
Right.
But it could be liposuction. It could be Botox and injections like Christina was talking to you guys about. It's, again, a mommy makeover is not really a surgery or a particular package. It's just some clever way of saying, hey, you mom, are you unhappy with things that your kids did to you?
Just do it all in one day. Yeah. Right.
Or do they do it in one shot? Is that like one time?
Yes, you definitely can combine things like a tummy tuck and a breast procedure. Obviously, you have to do things thinking about, is a patient going to stay overnight like Adriana did? And then you can maybe be a little bit more liberal with how many procedures you combine.
Okay.
Once you cross around the 5 to 6 hour mark is usually when most plastic surgeons will want their patients to stay in some sort of a monitored setting, whether it's in their own facility or in the hospital or whatever the case may be. If it's, 4 hours, 5 hours, then it can be an outpatient, meaning you come in, have your procedure, and then go home the same day. So it becomes a matter of, can I do this? Can I, the surgeon, do what she's asking me to do in 4 hours or 5 hours and not have to potentially push it into an overnight stay thing? Because it is a cost thing, right? So Adriana was, very honest.
Yeah, I had to pay extra. Right.
Exactly.
Right. But I will say, I can't see going home right after that. Like, I felt like after a tummy tuck, you need that 8 hours of sleep. You need somebody to monitor you, because it was painful. It's not.
Yeah, it's a big procedure. There's no doubt about it. The incision is, across your lower abdomen, kind of like from hip to hip. So imagine the C-section might be about this big. You're going much further, right from hip to hip.
Your hip to hip cut. Yeah, correct.
And then as we go through the skin and the fat down toward the muscle, then we start working our way up to loosen everything so we can pull it down, essentially. Most of the pain comes from the muscle tightening. So in your case, Adriana, having such a significant diastasis and having those hernias, you had a lot more muscle and abdominal work than the person that doesn't have, such a significant diastasis or hernia. I will tell you that there is a medication that came about maybe 4 or 5 years ago, and it's a long-acting numbing medicine that's called Exparel. And that's commonly used to do nerve blocks. And in the setting of a tummy tuck, it can be injected along the muscle when the plication, which means to bring together the muscles, and that's done in the center to bring the waist together. When Exparel is injected there, it really helps a lot with the numbing. Yeah. So I don't tell anybody that they're going to have no pain or be completely numb, because that's just not reality. No. But I'll tell you that there are some situations where patients have said to me all they've needed was Advil to get through it.
I'm back in.
And other times, people have said, oh, no, this is really uncomfortable, and I needed to use some, narcotic medication for a few days. But almost always in my practice, I don't want to necessarily, say that it's only me, but in my practice, I'm able to get patients home the same day of a tummy tuck.
Okay. Oh, that's great.
Interesting. So now, how many consultations do you typically have with a client before? I mean, I know for a lot of people, this is obviously a huge decision. So
sure.
Is it typically only like 1 or 2 consults? Or do you have people that come in like...
Colette will text you every day.
Well, I'm not sure. I only did 1 consult. 1 consult was all it took.
Yeah. So to Adriana's point, the vast majority of people is one time. And I might be the third person they're talking to, right? So they've had other consults because they're trying to get different opinions or find which physician they feel comfortable with. But the vast majority of the time, it's a 1 consult. Sometimes we can almost consider it a 2, because the first time was the hi, how are you? Nice to meet you. And let's find out what your concerns are. And we talk about the concepts of the surgery and what makes sense for you specifically. And now that you've decided you want to move forward and you want to move forward with me, then we might have a more in-depth preoperative visit. So now it's more of like, okay, we're going to get into the nitty-gritty that we may have or may need to review rather from the first time, because it's a lot of information sometimes, and it can be a little embarrassing, especially all the markers and stuff like that, and standing in a gown and whatever the case may be, right?
Drawing all over you.
Exactly.
And I was like, just give me an invoice. I'm like, whoa, okay, so let's go back on that.
Yeah, wait, can this be like financed? This is like is it like, is
Yeah.
that something that
Yeah,
can-
some doctors can finance.
Yeah,
Yeah.
definitely can. And there's a couple different ways, right? So there are some companies that you can basically apply for like a line of credit, for lack of a better term.
Okay.
And they have different programs where there are low interest rates, short periods of time, high interest rates, long period of time, 0% to special limited time deals and whatever the case may be. Some plastic surgeons will allow you to, may sound silly, almost like a layaway plan where you can kind of pay your installments. You know, the thing that ends up happening is I personally have been a victim, so to speak, of I promise to pay you, the IOU
And then they
plan,
don't. Yeah.
and then I can't take the implants back out, right? Or
Yeah.
I can't put their hernia back in, or whatever the case may be.
Right.
So in our practice, we don't put people on payment plans after surgery. We can do it for before, unless they're using, some sort of financing where they've gotten that line of credit type thing and they're paying us, and then they can do whatever program works well for them.
So let's say Colette wants to get her boobs done by next year. We'll start her GoFundMe page.
There you go. There you go.
Oh, yes. For her
We'll
birthday.
start collecting next month, and then we'll little by little we'll put it in.
I like the idea.
I like it.
Not that I don't need a new house or anything, but
No.
But
Like, that's
priorities.
Colette.
Priorities.
Yeah, right, exactly.
Priorities, right?
Do you find that you have to talk people? I mean, obviously, it's your job to give honest opinions with people. People come in there with ideas in their heads of what they want or what they think is going to happen. But do you find a lot of times you have to talk people down from what they think they want to get? If that's the right.
Yeah, no, for sure that's happened. And, I think that it's really important, in my opinion, to set realistic expectations. I think that social media and the way that certain celebrities portray themselves create completely unrealistic expectations of what injections and surgery can do. And that's because of the power of these face tuning and airbrushing and filters, whatever the case that, can be done. So when someone is starting to go down that pathway of what I consider to be an unrealistic expectation, I try to kindly point that out and say, okay, unfortunately, that's not a realistic plan. What we can do is make an improvement. We can't make it go away, for example. Think back to when Christina was talking to you guys before about the idea of having a wrinkle in a shirt versus a dent in your bed. Mm-hmm. So the dent in your bed, she can try to pump a whole bunch of filler in there, but at some point it just looks like filler in a dent,
Right.
And so I think that there is a very important psychology to the aesthetic surgery, just as there is, as Christina was saying, with the aesthetic, injectable side of the aesthetic medicine. So I thankfully it's not often, but I do have to talk people off the ledge sometimes.
Yeah, because I remember going to some of my consults or my after the recovery, because you do have to meet with the doctor after and make sure everything's healing's fine. And you'll see some of the patients and I'm like, oh my God, did you tell her that she has enough is enough? That's that's too much. Some people are in there and they're addicted to it. Enough is enough.
It's interesting that you say that. The one nice thing about aesthetic medicine that's different than other areas of medicine, and of course, I'm sure Dr. Asaad can say this about plastic surgery as well, is that I decline a lot of people.
Yeah.
If I feel as though you have unrealistic expectations, I decline you as a client and as a patient, because I feel like we're not at the same page. We're not on the same page. And I cannot meet these expectations because your expectations are just just
out there. Yeah.
And I have had someone show me their face on Facetune on their cell phone and tell me, can you make me look like this? And I said, absolutely not. Yeah, absolutely not. And that's the problem. There's a distortion in reality.
Yeah.
And that goes back to what we were saying about that fine line between mental health and aesthetic and plastic surgery, right? Also, a lot of complications can happen. So it's super important to go to someone that can manage these complications, because they happen. They happen to the best surgeons, best injectors, best everything.
Yeah.
They happen. But those people that know how to manage those complications can really get you through anything.
Right.
Yeah. Now, Dr. Asaad, do you work out of your facility? You do your operations in your facility or in a hospital?
So just about all of the cosmetic stuff that I do is out of a surgical center that we have in Old Bridge.
Oh, okay.
Only in the setting of like, so when I mentioned to you guys before I do some mastectomy reconstruction, that would be in the hospital.
Okay.
If we needed an overnight stay, because that's what we were doing, then we typically do that in the hospital. Currently, our surgery center doesn't have the overnight capacity. The only other option would be to get like a private nurse and be in a hotel over the night, and some people have opted to do that.
Yeah. No, because you do need.
Colette, I'll be a private nurse.
There you go.
Oh, I'll be there with you, Colette. I'll be there. I'll hold your hand through it.
I can't wait to tell my husband this is going on.
Breast augmentation, you may not be surprised to hear the statistic, is like the most commonly done cosmetic procedure in the country. And so it's pretty routine. Again, it's still surgery. And there's a saying that minor surgery is surgery on somebody else. So I don't want to make it sound like it's nothing, but it's a procedure that maybe you've been thinking about it since you're 16, and all of a sudden in an hour and a half, your life is completely different.
I know. I think about that all the time, but then I'm like, I always want to make sure. What? Stop. This is my biggest fear is that. So I am small chested, but I'm pear shaped. Like not that I'm not like huge, but I'm not a petite girl. So I'm always worried that if I have larger breasts, I'm just going to look bigger. No, but that's the truth. That happens a lot. People with bigger breasts tend to look larger.
And I mean, they're the ones that fit your shape.
Yes, I know. And that's what I think that the doctor really helps you decide, like what fits your body type.
Another thing about plastic surgery is like, it's not like you have to keep up with it. Just because you have a tummy tuck or you got lipo, it doesn't mean it's going to go away forever. Like you have to keep up with it. A lot of people think it's like a fix and it's for your whole life. No, it's not. Like you still have to watch what you eat. You still gain weight. I mean, you don't gain weight. Like I feel like my stomach always stays flat and it always stays small, but everywhere else kind of gets bigger.
It's got to find other places.
Exactly. That's exactly right.
Right? It needs to find other places to go.
Right, it does.
In my case, I wish mine came up here, but it tends to go to my thighs. But, we can't have it all.
It's not a quick fix. I'm sure Dr. Asaad will tell you. It's that you have to keep up with it. And that's one thing my doctor told me. He's like, don't think this is like, you'll be skinny for your whole life. Like you have to work. And I thought like, because when I was going into the surgery, I had the twins, I was 190. So I'm like, oh, how much weight am I going to lose? He's like, it's only going to be like maybe 10, 15 pounds. I'm like, what the hell? I'm paying you all this money and it's only like 10, 15 pounds. I'm like, seriously? I'm like, come on. I'm going to lose 50 pounds on the table. Like, no, you'll be tighter, but your weight, you still have to work on losing weight.
Correct.
And that's what a lot of people feel like it's, it's a quick fix and you're done.
Yeah.
No, you're absolutely right. And, liposuction in particular, some people have heard I'll call it a rumor, that if you have liposuction on one part of your body, that you end up getting bigger on another part of your body just as a reflex. And number one, that's not true, but it's not completely untrue because of actually what you said, Colette, is that if a person doesn't maintain that healthy lifestyle that they hopefully are doing prior to having that liposuction procedure, or if they take that liposuction procedure as an excuse, great, you finally got rid of my muffin top, and now I can have all the ice cream and pizza I want.
No.
Then you start gaining weight, and it's got to find somewhere.
Right.
Because the science behind it is that we're born with a certain number of fat cells, and we don't get more fat cells or less fat cells as we go through life. When we gain weight or lose weight, the fat cells we have either swell or shrink.
Oh, this is interesting.
And we have a predisposition in our DNA that, so for example, you said when you gain weight, it goes to your thighs. So that's your spot that your body wants to put it in. Now, if you had liposuction on your thighs and you said, sweet, my thighs are now thinner, I'm going to go and start binge eating, then your thighs can only hold so much because we've thinned it out. It is going to go somewhere else, but we can't direct it to your breast, unfortunately.
Right. It won't tell you where to go.
If only.
And a lot of people think lipo is an easy surgery. It's not, because I remember being black and blue from it.
Oh yeah, for sure.
Yeah. Everybody thinks that like once you do lipo, like you could go out in a bikini. You can't.
No.
You're black and blue. It's pretty, it's an intense recovery too. And I had to wear like a bodysuit.
Yep.
Oh, I did the drains. Oh
You
yeah,
did
that
the-
was terrible.
Yeah, for attack for sure. Yeah.
But what about the scars, Adriana? So now this is what I was worried about, the tummy tuck. So now you have a scar, but it's low.
I
you
have a scar. It's hip to hip. If I do wear a bikini, because I feel like I have the tummy tuck, so why not? So I do wear it.
yeah.
But if you wear it up, it's kind of under where your underwear line would be. It is hip to hip, but it is fade. It does fade. It doesn't stay. It doesn't stay for a long time. But if you are a smoker, it's a whole nother world. Because when I had my, which I'd never smoked a cigarette ever again after having my surgery. Once the week before I had my surgery, I was out with my friends and it was like my last hurrah. And I had one cigarette and I had the tummy tuck. I go to have my consultation like 2 days later. And the point of where the stomach, like where your circulation didn't heal right. It was starting to like it was what is that called? I don't remember what it's called.
Ischemic and necrotic.
Yes, where your skin is actually dying.
Yep.
So the doctor looked at my husband and he's like, "Were you smoking around her while she's in recovery?" And he's like, "No, I haven't picked up a cigarette in like 2 years." So he looked at me, he goes, "You were not so truthful." I'm like, "I had one cigarette." And he said, "That's all it took. It was one cigarette." He said, "I would have delayed it because of the nicotine in your body. It made my skin die where the circulation was not getting to my stomach." And I freaked the hell out because I'm like, I don't want a hole in my stomach. But we were able to, with antibiotic and creams, he was able to heal it. And then he told me eventually if I wanted to do a laser to like fix it, which I didn't get that far, thank God.
Good.
But that's another point. Like if you're a smoker, you cannot, like, because I've heard people doing breast augmentations where you actually, like the skin dies under the scar as well because of smoking.
Yeah. Smoking, essentially what happens is the nicotine in the cigarette is what's called a vasoconstrictor. So the blood vessel, consider it like a tube. And if you have nicotine in your system, the blood vessel tube constricts. And we have found that one cigarette can decrease the blood supply to the skin, which is what's most important in healing after an incision, for about 4 hours. So I have to tell you, with all due respect to your physician, I don't know that that one cigarette is what put you over did it. But people who consistently smoke, so imagine a person who says, I do half a pack a day, which is technically light smoking, at least by old standards.
Oh, yeah.
That person basically has an entire 24 hours of having 25% less blood flow to their skin. So it's a reason that we definitely ask and screen people for smoking, especially when it's cosmetic surgery, because they don't have to have it, they want it. And so therefore we would say to them, all right, look, we really need you to work on stopping your smoking habit before we decide to do this procedure.
Yeah. And I will tell you, I never picked up a cigarette ever again. Because after seeing the effects of what it does to your body, I was like, no, that's it. It's not worth it.
Yeah, and I understand. It's scary.
It scared the shit out of me after seeing that. And I'm like, oh my God, I'm going to have a hole in my stomach. I did all this and for cigarettes. No, it wasn't worth it.
Oh gosh. Yeah.
Well, thankfully I don't smoke, so we don't have this.
Yeah. So you're okay. You're okay.
So there we go. Oh, Christina's back.
Sorry, guys. Almost lost you.
That's okay.
Do you have a certain procedure that or an area that you particularly like to work on best, Dr. Asaad? Like, is there?
So, I mean, honestly, I probably would say breast surgery. So whether it's for reconstructive or cosmetic purposes. Next, I would say in the cosmetic realm, tummy tucks, actually. And as far as, kind of getting into like more general surgery in the reconstructive space, it's the breast reconstruction again. So the mastectomy reconstruction, whether with implants or even using patient's tissue. So that's my jam.
That has to be like the best part. God forbid, the cancer patients that had everything removed and you rebuilding it. That has to be the most rewarding.
It really is.
Yeah.
It really is to be able to kind of give back something that life has taken away and give them some sense of confidence. It really does feel good.
It's amazing.
Well, I'm sure it feels good too, because everybody afterwards is totally in love with you. Because I know I was like, woohoo! Thank you. Thank you so much.
That is a good feeling too.
No, it is. I'm sure. And like you watch these. Another thing to stress is, somebody said Dr. Asaad is the best. I'm so happy with my results. I barely have any scars, and I'm so proud to wear my 2-piece swimsuit.
Oh.
Awesome! Congratulations, Bonnie.
Thanks, Bonnie Joe.
But that's great. That like and as I was saying, like to not be ashamed of doing it and to just feel good about yourself. That's what we wanted to promote out of this. Like don't make it so taboo. It's okay to get it done. It's okay to talk about it. I'm the first one that'll say, no, I didn't go to the gym. I had a tummy tuck.
Yeah.
Because something like in my case, it would never be fixed. Like I would still walk around with that.
Right.
My intestines hanging out and all that.
Yeah. I mean, and that said, I mean, again, I can appreciate the overly logical mentality of, well, you don't have to have that surgery. Why are you putting yourself? Right. I get it. Right. But on the flip side, there is nothing you could have done to tighten your skin and put your muscles back together. No. Like, there's just about nothing you can do to make your breasts any bigger than they are.
I've tried.
Exercises, hormone pills, no.
I must.
Yeah. That's awesome. I mean, I think that ultimately it's just a matter of, realizing that there is something that can be done. And if it's going to make you feel good about yourself, then why not? I mean,
and it's okay to do it. Right.
Yeah.
Right. But it's also
important. That's the most important thing. It really is. That's what I stress the most.
Yeah,
and no matter how much like your spouse will tell you it's fine and you look great, you have to feel good about yourself.
I agree.
And I think that's super important. And, when I do notice that the motivation is the spouse, like a woman is getting her breasts done because her husband wants it, that's a big red flag for me. Because they're going through the surgery, not the spouse, and so I think it's super important to do a little bit of investigative work on our side. Christina and I trying to figure out what is the motivation of the patient, what are their expectations, and making sure that, we're on the same page, as she was saying before. And I also think patients, need to do their homework. They need to make sure that the person that they're going to knows what they're doing, has, the appropriate certification and training. One of the issues that comes up in the setting of aesthetic surgery is there's really no policing of who can do it. And so anybody, especially in the state of New Jersey, can say, hey, I'll do your breast augmentation, I'll do your tummy tuck, whether or not they have the appropriate training in it or not. And that's where sometimes people get in trouble. And by people, I'm talking about the patients. You guys may have heard stories of people getting caulking injected into their buttock. Or having breast augmentations done in a garage-based surgery room. I mean, I don't know how they thought that was okay.
No.
But and those are obviously extremes and probably not what most people would accept. But then there are even less perhaps understandable standards where there are a lot of wonderful dermatologists out there, but they're typically not trained to do breast augmentation. And yet some of them offer it, and then a person might say, "Oh, well, they're a great doctor and have a great reputation," and they just think of doctor, not what kind of doctor. Sometimes it's important. So, like Christina has spent a lot of time, as she shared with you, in getting the appropriate education and understanding all the anatomy, as you hear her talking about all the different science and chemicals behind these things. So she gives you, as she does me, the confidence that she knows what she's talking about. Whereas if someone is just like, oh, it's gonna be fine, great, just sit down and let me do it. I think you need to be careful like that.
Right. That's the same thing where people fly. Like you'll hear people flying out to Brazil or Argentina. And
I had a friend who did, and she had to get them taken out. I had a friend who did that.
I would never.
Yeah,
it wasn't a good situation.
Exactly.
You also have to think about what will happen if you have a complication there.
Right. Like
if you need a blood transfusion. What are the regulations on blood transfusions there?
And like, I remember being a mom of 3 and like getting ready, getting up in the morning and even doubting myself, like, oh my God, what if I, like, God forbid I die on the table and I'm going to die because I had a tummy tuck. Like, how ridiculous is that? And I was telling my husband, maybe I shouldn't do it. Maybe I should do it. And I remember even up to the anesthesiologist. And I remember like him putting, like, him getting me ready. And I'm like, listen, I have 3 kids. You have to keep me alive because I need to. And he's like, you're fine. And then we count down to 3 and I was knocked out.
Oh, that's the best feeling, that anesthesia feeling.
Yeah. And he's like, just count to 3. And I was like, 1, 2, and I was passed out. But like you do, like, I can't imagine going somewhere where you're not, like, you're in a different country and you don't speak the language. And I feel like with plastic surgery and with, like whatever Christina does, I feel like you need, like, the money. It's almost like you have to spend it. It doesn't.
Yes.
You can't.
Oh no, you can't skimp on it. You're not going on Groupon for your boobs.
Bargain on, because it is your body. It is your health. You're still going through a major surgery. You're still doing injections. You're still affecting your body. You need to be careful. You can't go to a third world country and get lipo or a tummy tuck.
There's always a catch.
There is always a catch, right? There is always a catch, and it's risky. You just can't do it.
Yeah, and like Christina said, I think that even though we don't really like to think about complications from treatments, whether they be injections or surgery, they happen, and you need to have the confidence in knowing. I mean, you shared with us that little area of your incision that wasn't healing.
Right.
Well. You had at least the comfort knowing your surgeon knew what to do, and he took care of you. It was fine.
He was in Long Island. He was a drive away. I knew exactly what to do. Right.
He wasn't in Miami or in Puerto Rico or in California, and you're now trying to FaceTime and show him your stomach. Or
Right. Yeah, it's true. It's true.
So.
But thank you guys so much for coming on tonight and for talking about what you do and making us all feel great always. And we will highly recommend you. I will share everything. Christina, I promise I'm getting to you.
Yes.
By the end of this year, I'll bring Colette with me.
Awesome.
And Colette will go to Dr. Asaad. And
you're going to come for my consultation?
Oh, I want to see how he draws on you because it's so much
nice.
We're going to play tic-tac-toe.
That's going to be a great ego boost.
Like, you need this, and then your nose. I'm like, no, dude, I was just coming here for my stuff.
What's wrong with my face?
Like, thanks.
You can't get that pen mark off for like 4 days. So
No.
it's on your mind every day.
And I'm telling my husband, I'm like, I think I need a 3rd job because I want to do this.
That's so
But
funny.
it's so great to have you guys on. Thank you so much.
Yes.
Thank you,
Have
guys.
a great weekend. Thank you, Dr. Asaad. And I will get your contact from Christina just in case I hint might want more lipo done.
Oh boy. Well, I'll definitely be in touch. Thank you,
It
guys.
is
You definitely empowered me. I feel
Awesome.
a lot better about this.
We will be there together, and I'll tape it for the show. Colette.
That'll be the pay-per-view session. Well, thank you guys for having me. Really appreciate it. It was really an honor to be the first man on your show. Thank you so much.
Yes,
It was so
first
much
male
fun, too.
at any time. I don't think we're going to have a male after you.
That's
Oh my
it.
God.
The one and only.
One and
Awesome.
only Dr. Asaad is allowed to come on. Thank you so much, guys.
Cheers
Good
again.
night, guys.
Thank you very much.
Cheers. Good night, Christina. I'll see you
Cheers.
soon.
Good
Take
night.
care. Bye-bye.
So, Colette, what do you think?
Oh my God, that was so fun.
We should do it. Come on, I want to come with you.
Oh my God, should we tape it? We could tape it. Just the consultation. You can't show my boobs, obviously.
Obviously, we're not going to show you. What kind of show is this?
Well, we are drinking wine and it is 10 o'clock. So
Yes,
You
it
never
is.
know.
10 o'clock. You never know. Exactly. So it was so much fun talking to them. Hopefully, we'll get to see them in person.
Yes.
Like I definitely want to go check out Christina because I've been telling her that I got to get in there. And, after COVID calms down, I'll go.
okay, I'll definitely come with you. I'm very interested. I've never really went down the whole Botox path yet. I haven't done, but I think it may be at that time. So.
I think, you know what? To be honest, I think I want to do the IV thing before I do
Oh yeah.
Botox. I think the IV weight loss thing, she might have me hooked on that. Anything that could make me lose
know.
10 pounds quickly, I'll
Yes.
do.
Weight loss. I'm in. Give me 2.
Hook me up. All right, so
my
I think I'm
friends.
going to wrap it up. I
We'll
will
wrap it
see
up.
you next week. Have
Okay.
a great weekend. Enjoy the rest of your
Bye.
week. Cheers to you. Good
Cheers.
night.
Good night, everyone. Thank you for joining.
night. Guys, thanks for joining. And thank
Bye.
you again, Christina and Dr. Asaad. So much fun.
Awesome. Bye, guys.
Bye.